we set, Kathy?
We are set.
Okay,
So
Secretary.
I'd like to call this meeting of the Connector Board to order, please.
So moved.
Do we need to do a roll call?
Kathy,
I believe
could
so, sure.
Yep.
Okay, Gary.
Hi, Kathy. It's Gary.
Hi, how are you? Michael? See him yet? Hey, Ruth? Didn't see him yet. Mark?
Here.
Cassandra?
Here, good morning.
Good to you. Dimitri?
Good morning, Kathy. This is Dimitri.
Secretary Sutters?
Present?
Nancy?
Happy holidays, Kathy.
Same to you. Matt?
I'm here.
Rena?
Hi, Kathy. I'm here.
Hi. And Zarani? Okay,
But I believe that means we have a quorum.
we do have a quorum.
And I think I'm seeing
Michael.
Michael.
Perfect.
Michael, you present?
I'm present.
Great. So I'm grateful for everyone, given our last board meeting, the willingness of the board to come together on 2 items today. The lease for the office space, which we had a lively conversation and asked Louis to go back. And I think looking forward to that conversation, as well as the business broker commission. I think we need to. Let me turn it over to Louis and the executive director's report.
Thank you so much, Secretary. And I'll be very succinct because we'll be economical this morning. But first, I just want to wish everyone, I hope you had some restorative time over the holiday and looking forward to 2021. And good morning to all. Thank you for your participation in today's special convening. There are a couple of items of unfinished business for the December 10th meeting, as the Secretary mentioned, and it will be helpful to complete votes on these prior to year end. Marissa Geller will also be providing a very brief interim report out on open enrollment statistics. As a reminder to all, in Massachusetts, open enrollment for 2021 coverage continues through January 23rd. Sometimes people see in the press that the federal open enrollment closed, but we continue through January 23rd. Pursuant to the board's guidance on December 10th, we reapproached the landlord for 100 City Hall Plaza with a request to relinquish our 3rd floor space as of the end of our current lease in August of 2021. Significantly, that request was honored with only minimal adjustment to lease costs on the remaining floors. We've scheduled 1 hour only for today's meeting, so without further preliminaries, I will yield back for the coverage of the 3 agenda items. The first of which I believe is the presentation of the revised lease.
And we handing that over to Andrew?
Yes.
Good morning, everyone.
Welcome back, Andrew.
Thank you. Hi. So yeah, I will dive right into a presentation on the updated lease renewal. So just to begin, here again is just an overview of our current office space. We are at 100 City Hall Plaza, where we occupy the 6th floor, as well as half each of the 5th and the 3rd floors. And we have just over 19,000 square feet in that current space. This is where the Health Connector has been since 2007. The last time we renewed the lease was in 2015, and we extended it through August 30th, 2021. And during this final year of the current lease, our price per square foot is around $42. And as we described in the last presentation, the Health Connector earlier this year began an extensive market review to determine whether it would be advantageous to move to a new space or instead to renew and stay at 100 City Hall Plaza. On December 10th, we took We presented to this board the terms of a negotiated renewal of that lease. And this board at that time declined to vote on the lease renewal. And just to remind everyone what the terms of that prior proposal were, they were to renew all 3 floors for 5 years. And the effective average rate for that renewal period was $45.26 a square foot. That proposed renewal also included an optional right to terminate the 3rd floor after 3 full years, and carried over an ongoing right to sublease any of the space at any time. So citing some concerns around committing to 100% of our current space in light of the growing movement toward hybrid work models, this board did decline to vote on that proposal and instead asked whether staff could settle on terms that would facilitate the move toward hybrid work on a shorter timescale. In response to the board's concerns, Health Connector staff have renegotiated a renewal of the lease. And in order to more expediently transition to hybrid work, as we've discussed, we are declining to renew the 3rd floor. The updated lease renewal is very similar to the prior proposal. It includes new terms for the 5th and 6th floors beginning August 31st, 2021 and going through November 30th of 2026. The average effective rent rate for that period is $45.44 per square foot, reflecting full use of a tenant improvement allowance, which I'll discuss in a moment. And as with the prior lease renewal proposal, the landlord will be giving the Health Connector 6 months of free rent, applicable to the final 3 months of 2020 and the first 3 months of the renewal term in 2021. Further, as I mentioned, there is a tenant improvement allowance, which we can use to make improvements to the 5th and the 6th floors if desired, or instead we can use that money to abate rent starting in 2022 and spread out over the remaining term of the lease. And as before, the Health Connector retains the right to sublease if we desire. So as I mentioned, the updated lease renewal is very similar to the prior proposal, but there are a few changes worth highlighting. As described, the 3rd floor will no longer be renewed at all. And because of this, the landlord is no longer offering free rent for the 3rd floor for the final 3 months of 2020. Further, the total amount of the tenant improvement allowance is reduced. Given the many moving parts of this lease, one figure that we have been focusing on for purposes of comparison is the price per square foot. Here, that price in the updated renewal proposal is increasing by about 0.4%, from $45.26 to $45.44. On net, by releasing the 3rd floor at renewal, the Health Connector will save over $1.2 million compared to the prior renewal proposal. So moving on to the analysis of the updated lease renewal proposal, Health Connector staff believe that these terms are favorable, as they not only provide significant savings when compared to the prior proposal, they compare favorably as well to other options on the market. As I just described, the Health Connector's termination of the 3rd floor allows us to realize significant savings on our office space costs. And further, our review of the market for office space in buildings similar to 100 City Hall Plaza revealed rates as high as $65 per square foot. Those amounts have not decreased significantly despite COVID, which our research indicates is due at least in part to a vacancy rate in Boston that remains below historical average. The renewal rate of $45.44 per square foot is significantly lower than rates at comparable buildings and represents a modest increase over the current rate of $42.13 a square foot. Further, our continuing right to sublease means we will be able to evaluate whether future reductions in office space are necessary, although none are anticipated at this time. So I will pause here for any questions or discussion from the board.
Thank you, Andrew. So let me just open it to the board. Any comments or questions? I'm very appreciative that you went back. This is significant movement. Appreciate that. So let me just open up to the board. Any comments, questions, concerns? Good direction, good progress?
Great job.
Good morning, Zarni. Anybody? All right, so I'd ask, oh,
Just
there-
moving on to the vote.
yep,
Go ahead.
moving on to the vote. So may I have a motion for,
So moved.
is there a second?
I'll
Second.
second.
All right, any further discussion before I do a roll call, or Kathy does a roll call for us? All right, Kathy, you want to do the roll call, please?
I sure will. Gary,
Yes.
Michael,
Yes.
Dave Ruth,
Yes.
Mark,
Yes.
Sandra.
Yes.
Dimitri,
Yes.
Secretary Sutters,
Yes.
Nancy,
Yes.
Matt,
Yes.
Rena,
Yes.
and Zarni.
Yes.
Thank you. I really appreciate going back. And Louis, I know that Alden, I think is going to, who works with me, is going to share some like the future of work with the connector staff and the like. So thank you. I think this is a good movement and appreciate it.
Thank you. Thank you all.
Thank you. All right. So turn it back to you, Louis.
Yes, so our next agenda item is for a requested approval for a new schedule for broker commissions for 2021. We briefly discussed it on December 10th, but I've asked Chaitra Sanders to come and do the formal presentation and request board discussion and vote. So Chaitra?
Thank you, Louis. See if this goes into slideshow. All right. Good afternoon, members of the board. Today, I will provide a brief update on the Health Connector for Businesses' overall support to the small business community and its assistance during the healthcare and financial crisis of 2020. Additionally, I will be asking the board to approve the revised broker commissions proposed to effectuate on January 1st, 2021. As the board knows, small businesses continue to face unprecedented economic disruption due to the impact of COVID-19. The Health Connector has been supportive and flexible since the onset of this disruption by providing payment extensions, resources, and information on how to access affordable coverage, as well as continuing to engage brokers and support them while they assist their small business clients in providing the best options to their employees. As mentioned in the strategic planning presentation at the board meeting earlier this month, a Health Connector for Business survey revealed that small businesses that shop on the Health Connector for Business are highly satisfied with their experience enrolling on the platform and the benefits of the choice models, with an 86% overall satisfaction result. This is a view of our current membership as of December 1st, 2020. Overall, our membership has remained relatively stable. We saw a slight increase in member level terminations, but our retention levels remain above 85% on a monthly basis. And the view here is the group count. While the previous slide was the member level count, there has been an 11% increase in groups throughout the year that have enrolled on the platform, while membership enrollment has increased by 15%. Given the change in the economic climate, we were expecting little to no growth during the 2020 plan year. We saw 402 new groups and 2,389 members account for new sales on the Health Connector for Business, only slightly lower than originally expected prior to the onset of the COVID pandemic. Many small businesses looking for ways to provide affordable health coverage tailored to the needs of their employees have chosen to offer a choice model plan during the 2020 plan year. Choice models account for slightly more than half of the group and membership enrollment. We're pleased to see this unique purchasing model continue to appeal to small employers. The Health Connector for Business program has made it a priority to work collaboratively with the broker community to offer affordable solutions to small businesses across the Commonwealth. We conduct regular trainings for brokers, either refresher trainings for brokers who have sold through us before or trainings for brokers who are new to the platform and the program. The recent trainings were well received with a special interest in the Connect Well program. Brokers are the leading source of new membership. The number of certified brokers and enrollments from brokers have steadily increased throughout 2020. Of the 2,389 new members enrolled during the 2020 plan year, brokers were responsible for bringing on 1,766 of those members, a 74% share of new membership. The last update to broker commissions was in January of 2018. Based on the annual survey of the plans with the largest Health Connector for Business membership, the connector has determined the market for broker commissions has shifted, and we need to adjust accordingly in order to remain competitive and on par. Broker commissions for the small business product line are anticipated in the budget and contingent upon board approval. They were included in the budget projections since our fiscal year starts July 1st, 2020, and the changes, if approved, would start on January 1st, 2021. The proposed changes to the medical plan broker commissions are shown in the table on this screen. We are not recommending a change to the 1 to 4 employee group size or the dental plans. For the 10+ employee groups, the large majority of the plans surveyed offer $30 per subscriber per month. If the board approves the new commission schedule, the changes would be effective on January 1st, 2021. And I'll take a pause here and open it up for any questions or discussion from the board.
One thing I'll note in anticipation of questions is the off-exchange commission range for the 10+ employees shows 24 to 30, but the predominant number of carriers are much closer to the 30. I think there's an outlier carrier that has the lower $24 rate. So this is not a range where the midpoint is average. It's a range where the 29-30 level is predominant, except for one outlier.
Can I,
Secretary?
Who's that? Nancy? Mark?
I will
Go ahead,
see
Nancy.
Mark as the expert on this.
All right,
Oh,
Mark.
I want to say a couple things. First, I was on record in the last board meeting saying that I appreciated the look to the market. The brokers and the connector have developed a much better relationship the last several years, and we know that there was history to overcome there. So Louis, I can't underscore it enough, the energy and effort put forward to mend those fences, so to speak, has been done very well. And so as a result of that, and then this is a next step in that to say, okay, we want to make sure that whatever we're offering inside the connector is comparable with what's offered outside of the connector. And so I appreciate that nod, because that's exactly what this is doing. And then third and finally, I'll just make sure I mention this, that most brokers are small businesses. So the fact of the matter is, by doing this, you're recognizing the value they provide those employer groups, and we're helping the small business community as well by doing this. So I applaud the effort. Thank you.
Thank you so much, Mark.
thank you, Mark. Nancy?
Yeah, so thank you, Mark. Those comments were really helpful. So this is the amount we pay for a new group and at renewal. Is it? I guess I'm confused. I know commission schedules sometimes have different amounts for when a new group comes, when it renews, and sometimes there are persistency bonuses as well. Is this take case?
Hey, Troy, if you could elaborate, but it's my understanding that we don't have a very complex setup. We don't, do consistency payments, but these rates do cover both new and existing groups.
Yes, so these will cover new and existing groups starting on the coverage month of January 1st, 2021.
Okay.
Yeah, and I could, Nancy, I can add in a little bit of context here too. In the larger group market, you are right, there is a declining commission scale most of the time. It's also on a percentage of premium as opposed to a fixed dollar amount here. So that's why the market moved away from those declining new versus renewal because there was no index for inflation. So just to provide a little context there.
That's helpful. Thank you, Mark.
All right. Any other comments?
Hi, this is Dimitri. I just had a quick question. Given the fact that a significant number of businesses in the Commonwealth are those small businesses from 1 to 4, and we're trying to encourage greater participation of those businesses within the connector, would it make sense at some point to look at the commission structure from 1 to 4 to ensure that there is parity commission with regard to off exchange as well as on exchange, so that brokers have the incentive when those small businesses approach them to point them to the connector?
Chaitra, I'm going to ask you to elaborate, particularly on these ranges. In the 1 to 4 employee group size, are they similarly grouped towards the lower end of that range? Or
Yep, the majority of the carriers surveyed were the $10 per subscriber per month. They had not changed their 1 to 4 either. So we went to keep with parity with them.
So
that is true. I can validate that, Louis, and I can also say to Dimitri's point, that is the way the private market works. There is incentive provided where the carrier would like to grow their book of business. But what we've seen over the years is that they're really on par with one another now. But you're not wrong in your thinking that if we offered a little bit more incentive, it may create more of an awareness or an incentive to actually bring business to the connector for business. So I think it's a valid point.
And I concur. And so, Dimitri, I think what we're doing is rough parity with off exchange, but I think what you're suggesting is our consideration of possibly enhancing the promotion for the very small groups because they do tend to be underserved, and perhaps not for this plan year, but for next, I would propose that we give a careful look at that, if that's acceptable.
That seems reasonable, Louis.
Can I?
Yep.
I just want to make a comment. I'm not disputing or disagreeing with any of the assertions. I just want to make sure that we keep in mind that from an actuarial perspective, these groups are definitely riskier. They tend to cost more money. They have more adverse selection issues, a lot of different things that happen with them. And I just want to make sure that, and that doesn't make them bad groups, it just makes them different. And I want to make sure that if we are doing anything that provides incentive to move more of these smaller groups to the connector, that we then don't turn around and start trying to compare our risk pool to the broader risk pool outside of the connector and say something is wrong.
Understood, and that's a good point, Rena.
Yep. I'm sorry, Dimitri, did you have something else? I saw you shaking your head.
No. I was just taking under consideration Rena's point, which is a very strong point.
Yep, great. Okay.
I have one comment, if I can.
I don't know. I didn't see you shaking your head. I didn't see you raising your hand. I don't know.
My hand raised on the appropriate Zoom raise hand. I use the chat raise hand. So I am fine with where this conversation is going. I just wanted to get on record 2 points. The first one is I don't care about parity that much for parity's sake. And although I very much appreciate the broker community, I don't think a justification for paying them more is for a desire per se for supporting them or any other small business for that matter. I think the analysis that matters is what extra we're paying relative to how we are expanding access to coverage in the Commonwealth. And I think it's a reasonable point that in order for us to maintain coverage in the Commonwealth that we want, we should pay market rates. And so that seems reasonable to me. But the analysis that I care most about is how much would we lose if we paid less, and how much do we gain if we pay more? I gather through this analysis that we think that paying more will broadly enable us to maintain or expand the broader objectives that we have of expanding coverage to people in the Commonwealth. And in that sense, I'm supportive, but I just wanted to go on record for my motivation is much more about that than something like parity for the sake of parity.
Thank you, Mike. And I would just clarify a general philosophy on this that we've held, which is we don't want to disadvantage brokers that work with the connector, but neither do we want to be in the business of swiping existing business that's already insured from other carriers. So that's why the parity principle has been key to us to date is we want to reach currently uninsured, but we're not in the business of just trying to take other business from other insured plans or brokers. So for the time being, we've been really focused on parity. And those are the two reasons why.
Michael, you good? All right. Any further discussion? I think we can try and move this to the board vote. All right, so we have a vote before us. May I have a motion, please?
So
So
moved.
moved.
I think there might have been a second in there. Is there a second? Whoever wasn't the first is the second.
Right, you can pick me or Dimitri, that's fine.
All right, thank you. Is there any further discussion before the board, please? Before I call the vote? All right, Kathy, can we have the
Ready.
drum roll or the roll call, please?
Gary,
Yes.
Michael,
Yes.
Ruth. I hear anything?
Yes,
Yes, yes.
Okay. Mark,
yes.
Cassandra,
Yes.
Dimitri,
Yes.
Secretary Sutters,
Yes.
Nancy,
Yes.
Matt,
Yes.
Rena,
Yes.
Zoni.
Yes.
All right, thank you. Now, Louis, we're going to do a brief open enrollment update.
Yes, we will. And it's a non-voting item, but I've asked Marissa, even though the results are very midstream, because as noted, our open enrollment is still going strong, but I've asked Marissa to come and just post the board on where we stand as of the end of December as an update.
End of December, the end of 2020 works fine by me.
Great, thank you. Good morning, everyone. Today, I'll provide a brief update on open enrollment. Enrollment is down from last year due in large part to Medicaid benefits protected as part of federal COVID relief packages. However, we're seeing strong retention and relatively normal shopping activity among renewing members. I'll also walk through some of the outreach efforts we've engaged in to help reach people in this unusual year. So as of last week, about 9% or 17,000 renewing Connector Care members were moving to unsubsidized coverage for January. This often happens if we aren't able to verify someone's continued eligibility for subsidies or if they, based on information we have on file or data sources that we have access to. Members may renew with subsidies if they provide updated information. And you can see that this year, the return to subsidies was much slower than in previous years, possibly due to differences in the population that we have this year, or perhaps due to members' uncertainty about their 2021 income, leading them to delay action. The steep drop you see at the end of the magenta line corresponds to when members received their bills for January coverage, which did prompt a number of updates. Membership as of last week was around 277,000 non-group health members, which is down about 6% from January 2020 enrollment at the same time last year. Unfortunately, this year will break our 6-year streak of year-over-year growth for each January. And Medicaid protections are a huge driver of this decreased enrollment, as we typically see a decent amount of movement between Mass Health and Health Connector programs. In addition to fewer new members who are coming from Mass Health, we've also seen increased movement to Mass Health this year as members have reported decreased incomes. Overall, the total pool of people who are eligible for a Health Connector plan heading into 2021 who could enroll is about 25% smaller than it was last year. I will note, though, that the component of new members who we've seen who are brand new to HICS remains pretty comparable to last year, with the total difference really being driven by lower enrollment from people who were already in HICS. And member retention heading into January remains high at 94%. With 20% of renewing members actively reviewing their options, selecting a plan, or effectuating coverage, shopping activity is just slightly lower than at the same time last year when it was about 22%. It's important to note that if a member engages to review their options, they may still ultimately conclude that their current plan still works for them. Members who do change plans, by and large, seek out lower cost options by switching carriers or metallic tiers. And we continue to see many members shifting down to bronze coverage, and the majority of new members who are enrolling in unsubsidized or APTC only coverage choosing bronze plans, continuing a trend that we've seen since 2018.
Marissa, just to be sure I understand this, the Connector Care bar says that of the people who shopped, 80% didn't change and 20% did. Is that right?
That's right. And
okay,
so the total number for those shopping was about 9,800 members. So it's still, it's a small subset.
Okay, thank you.
Okay. Switching gears now to outreach efforts.
Marissa, why don't you just pause for a second?
Sure.
So before she gets into media opportunities, so just to give you a sense, so we're seeing and we're projecting an 11% increase in the Mass Health enrollment so I'm doing a fiscal year, but initially we had thought about 14%, but it would look to be about an 11%. So that's it's like you think 20,000 a month, basically, increase in the Mass Health program. So.
And then Secretary Sutters or anybody, when will we have data on the total population? Is that, I know CHIA or HPC, I always forget, it kind of tracks this on a regular basis.
Yeah, we should have it in just after the beginning of the year. So like we should have it like January. I will actually, you know what, while we're on here, I will text my friends.
Okay.
Maybe while we're still here, I'll have a date for you.
Because I know there were some data that just came out nationally showing about a 6 or 7% increase in open enrollment in states that have concluded. But of course, that didn't give us any sense of all the moving parts like Medicaid and other things. So.
Well, and I would say that our Medicaid numbers are in line with other states.
Yeah.
You know, they're definitely right in the, you know, like the 10-ish% increases with states that we look to compare ourselves to.
Yeah. I mean, I think we should just feel very good and thankful that we're having a longer open enrollment period, which I think personally is always a good idea, but particularly this year when we know there's so many moving pieces and so many people who are going to be laid off. And fortunately, it's just good. So kudos to the Health Connector in this state for continuing this.
Yeah, I think particularly in years like this year, right, where there's so much uncertainty in people's lives, I think having a longer open enrollment. Sorry, Marissa, just.
No, I'm happy to take any other questions about the enrollment and shopping activity if anyone has them.
I just wanted to give the perspective of the Mass Health side of the.
Yes, thank you.
Yep, go ahead.
Marissa, is there anything making us concerned about some of the network changes? I don't know exactly how we'd see that, but are like always people shopping more than others, or what do we know from that?
Yes, always people are shopping a little bit more than others. And I know that we did have some member escalations last week as members called and we're trying to make sure that they could get a range of providers covered and trying to figure out if there was kind of a magic plan that would fit all those needs. And we have actively been working with those members and the carriers to make sure that they get that continuity of care that they need going into 2021.
I think at some point when the time is right, when the dust settles, it would be really useful to understand how some of those changes were experienced on the ground.
Yes, absolutely. All right.
Okay, media.
Yeah, so switching gears, we have a lot going on in both the paid and earned media arenas. We continue to focus our paid media on ethnic media outlets working to connect with underserved populations. New for this year, we're advertising on about 300 buses around Boston, including areas like Chelsea, Lynn, Dorchester, and Quincy. This messaging is targeted to people who are likely still working in downtown Boston and taking the bus to work from areas where we know there are higher rates of uninsurance. We've done more than 100 interviews and stories and publications throughout the state so far, with more to come. And navigators have also been doing interviews with local media outlets, many of them in Spanish, Portuguese, or other non-English languages. Additionally, throughout November, we did about 10 interviews with radio and TV outlets where we focused on reaching people who are in COBRA or who otherwise lost job-based coverage during the year. And we reprised our annual call-in helplines on the Spanish language TV stations, which give people the opportunity to call in and ask questions about coverage or to get connected with a navigator for additional assistance. And more than 300 people called into the first event this year. So sidelined from almost all in-person activities, we adjusted our day of coverage to be virtual this year, and we collaborated with exchanges from 15 states and the District of Columbia on outreach efforts for the first time, resulting in Get Covered 2021 Day on December 10th. Beyond exchanges, dozens of national and state healthcare organizations and celebrity ambassadors, including Sarah Silverman, Mark Hamill, and Steph Curry, helped to spread the word. Nationally, the campaign generated more than 30 million impressions across social media platforms. Locally, Governor Baker and Lieutenant Governor Polito provided a proclamation for Get Covered Day, and Secretary Sutters wore the Get Covered masks at public press events, which we really appreciated. Thank you, and thank you for bringing it again today. We also sent those masks to local elected officials, more than a dozen of whom posted material on or around Get Covered Day.
You'll see it tomorrow at the governor's presser.
Oh, good.
Yeah.
We adjusted our activities from on location to a series of live streamed events, such as interviews with local officials and navigators, cooking demonstrations, and live music performances, all of which generated 7,500 total views. And in case you missed it, video from the day is still available on our Facebook page. With just about 4 weeks to go, we continue to try and reach out broadly to reach uninsured residents. We also, for our existing members, have direct communications going out on a regular basis through mail, email, and phone. Paid spots like those we discussed earlier will continue to run on ethnic radio, TV, digital, and print outlets. And at the same time, our partners at Archipelago Strategies Group will continue to seek out interview opportunities for navigators and agency staff with local media outlets. Teams from Archipelago will continue to place signage in businesses and other locations and communities with higher rates of uninsured residents to supplement the nearly 2,300 signs that have been placed so far. We have an additional day of coverage slated for January 13th, and we're working on the schedule of activities for that. There are also ongoing conversations with the Get Covered 2021 group about doing additional social media driven activities in January, as many of those other states have extended their enrollment deadlines well into January as we have. And we'll continue with our in-house social media efforts, including organic and paid promotion on platforms like Google Ads, Spotify, Instagram, Facebook, LinkedIn, and Twitter. And we also are expanding use of video on platforms like YouTube as people are streaming more videos while they're home. We'll continue hosting monthly webinars for people who are seeking coverage. The next one is scheduled for January 13th, and they provide basic information about how to apply and what the Health Connector offers. And this one will focus on people who have experienced a loss of job-based coverage. We also have been posting those webinars to a video library that we added to our website this fall underneath our website's Help Center. And finally, we were given the opportunity to post messages through the Commonwealth's Alerts MA text system, which reaches about 250,000 people. Two messages that you see here ran in advance of our December 23rd deadline on the 19th and the 21st, and similar messages are scheduled to run in advance of the January 23rd deadline. So I can stop quickly there just to take any questions on the outreach, although I am not a suitable replacement for Jason Lefferts. I'll do my best.
So the one comment I have is I would ask next year that the connector do a vlog for individuals for whom their primary language is ASL.
Okay.
And I'm very sensitive to the needs of the residents who are deaf and hard of hearing, for which I have heard that a primary source of information they've received this year was through the governor's COVID briefings, because there is, I think we've had one briefing without an ASL interpreter. And so we are trying very hard throughout Health and Human Services to have major announcements also put out through vlogs, which is an animated ASL form of communication. And I would ask the connector, when you think of languages and primary languages, you add ASL vlog.
Thank you, Secretary. We will.
Excellent.
Other comments? I should have said you've done a great job. So I didn't mean that to be a, just making it even more communicative to other folks. Nancy?
Yeah, I was going to say, it looks like there's a lot going on in a particularly challenging open enrollment here, but important, as we said. This is not for you, Marissa, but since the call center is mentioned here, Louis, could you give us just a quick update on how customer service is doing in Faneuil since we last met?
Yes, I would say it's under, what do I say? It's in control. The abandonment rates have consistently been under 3%, which is the service level. The highly dissatisfied scores, although they do spike up occasionally on certain days, tend to be in the 10% and below range, and that's good. So I think in terms of minimal effective controls, we're in good place, so there's still room for improvement, significant improvement. There is some concern we have with regard to recent communications with Faneuil that indicate they feel as though they're losing money on the account, and so they have proposals for cutting back. Those elements are under active negotiation and discussion, and they're serious matters for discussion. But I think in terms of the day-to-day service at this time, things are under control.
And then do we anticipate perhaps like students, people do things at the last moment, and that's my recollection of some of the trends in past open enrollment. So are we anticipating a higher volume as we get near the end? And what's our level of confidence about Faneuil's ability to handle that?
I think, and this is, and what will be some of these serious discussions over staffing and budgeting, I think we're pretty well situated. We were well staffed for December payment, 23rd, which tends to be very heavy. I anticipate that we'll be adequately staffed for the January budget deadline. If your broader question though is about whether we might make up some of the 6% below in this time frame, I'm a little cautious about projecting that. We've done a lot of work on increasing the social media outreach and online and other mechanisms. I do really miss the on-the-street community-based activities, in addition to the, to the Medicaid dynamic, that we understand. But I don't know of any particular reason why enrollment will specially make up for the difference in January.
Yeah, okay. I mean, it's so hard to predict anything. We all miss everything on the street, community activities and everything.
Yep.
Yeah. All right. Other comments? Questions? All right. And if there's no other business before the board, I want to thank the connector staff and Louis and for all the hard work through an extraordinary year and for going back, particularly on the lease and other items. But if there's no other further business before the board, I would accept a motion to adjourn.
So move, Secretary.
I think there was a first and a second there. Are we ready for the roll call, Kathy?
Gary,
Yes.
Michael. Dave Ruth,
Yes.
Mark,
Yes.
Cassandra. Dimitri,
Yes.
Secretary Setters,
Yes.
Nancy,
Yes.
Matt,
Yes.
Rena,
Yes.
Zarini.
Yes.
Right. Well, I think that concludes our official business for 2020. I hope everyone has a safe and healthy new year. Thank you for all that you do to help residents of the Commonwealth, and looking forward to 2021. That's all I'm
Amen.
gonna say.
Amen.
Amen to that. Yeah.
Thank you all. Happy
Stay well.
2021.
Well,
Happy New
everybody.
Year, everyone.
Everybody.
Bye.
Happy New Year.